Are you someone that's suffering from hammer toes, crooked toes, toes that are going in crazy directions, not sure what to do, probably embarrassing for you? Well, stick around through this video and I'll show you exactly how you can have this fixed through a more cosmetic approach known as minimally invasive surgery. Stick around. So hammer toes are basically contractures in the digits. They come in all shapes and sizes. They kind of look like this. If this was your toes, they kind of cock up like this. They can be overlapping other toes. They can cause other toes to be pushed over. Sometimes there's a bunion involved, and the bunion is pushing the toes over, and this causes the hammer toe to form. So there's three types of toe deformities. We have the traditional hammer toe, which you can see right here, and you can see the toe is sort of cocked up. You have what's called the mallet toe, where only the end of the toe is sort of curved downward. And then you have what's called a claw toe, which literally looks like a claw. You can see here on this image. We sort of group all three of these into what we call hammer toes, but really the hammer toe has a very specific look to it. But for this video, we'll just keep it very simple and call them all hammer toes. And so this can be very painful for patients because these hammer toes can cause issues for certain shoe gears, especially women that like to wear heels. Also, this can affect even tennis shoes. Even diabetic patients can end up getting ulcerations and sores at the end of the toes or on the knuckle bones because it's rubbing against the shoes, and this can actually lead to some very serious complications like infection and amputations for the diabetic patient. But for a healthy individual who has hammer toes, it can be very embarrassing, just like the bunion. The bunion can be very embarrassing for patients. And like I mentioned in a previous video, sometimes it's not physical pain that's the issue, it's more of an emotional pain. And like I mentioned before, foot surgery has a cosmetic appeal to it. There is a cosmesis involved with what we do. And so it's very important to address the emotional burden that may be caused by the deformity for the patient. So there are some conservative treatments that patients can try. If the patient's not a great surgical candidate for surgery, we utilize taller toe boxes for shoes. We talk about orthotic management. Orthotics are inserts that go inside the shoe, and I've discussed this in other videos as well. And then so the orthotic can help with sort of rebalancing some of the tendons, and sometimes in some cases it helps with the hammer toe. There's also different straps and braces that patients can try, but ultimately to truly get rid of a deformity like a hammer toe, it's a mechanical deformity, so really the only way to get rid of it is through a surgical approach. And so, as you know, I am a minimally invasive foot and ankle surgeon. I really work with patients that not only are looking for a good fix, but also they want a cosmetic approach to it. They want not such a big scar on their foot. They want it to look nice for when they, show their toes off on the beach, or they want to wear sandals. Also, with the smaller scar, there's less chances of swelling. So before we move on to the minimally invasive approach, let's look at what a traditional hammer toe surgery looks like. So here you go. Here's an example of it right here. Very large incision on the top of the toe. Traditionally, the surgeon is destroying the joint in order to get the toe nicely aligned. And in some cases, and in most cases, the surgeon is using some sort of implant, whether it's a wire, a screw, some sort of metal to hold the toe straight. The one advantage with minimally invasive hammer toe surgery is that I don't use any pins, screws, metal. I use none of that. Everything is held in place through external bandaging, and I'll show you an image of that here shortly, but I don't use any sort of metal whatsoever to hold the toe straight. Sometimes patients have complications with the metal. They can have a metal allergy, or it causes irritation to the skin. And so through minimally invasive foot surgery, we don't have to use this type of implants, and we're able to get great correction without any of that. So like I said, here is the image of the traditional surgery. You can see a very big incision. The biggest issue with traditional hammer toe surgery is swelling, and patients will sometimes refer to this as sausage toes because the toes become swollen for so long. In some cases, the toe swelling can last up to 1 year after the surgery. And what we found with minimally invasive surgery is because the incisions are so small, we're not seeing that excessive swelling. There is some swelling to some degree, but it's nowhere near as bad as traditional surgery. So I'm going to take you through a couple of minimally invasive cases, and you'll see the incision size. You'll see the big difference between the traditional open surgery versus the minimally invasive. So let's look at this case right here. Here's a pre-op image right here. You can see the patient's second and third toes. They're cocked up just a little bit. It was causing her issues with wearing shoes. And so here is the after. You can see the toes are nice and straight again. You can see very tiny poke hole incisions. Again, you've heard me say this in other videos. This is the keyhole incision, very small incision. And through this, we're able to realign the bones and do some soft tissue balancing to get the toes nicely aligned. She, after surgery, was placed in a post-operative shoe for just 2 weeks, and she got right back to her normal shoes 2 weeks after. So she was back to normal activity by week 4, no problem. She's doing excellent now. Here is another case. So in this case, it's a little different. You can see the toe is not necessarily cocked up, but it's drifting over. And this is an interesting case. This was caused by a car accident 10 years ago. And in this case, the ligaments that hold the toe straight were torn. So over time, this became a chronic deformity, and so the toe started to drift over. So again, in this case, something very similar was performed through a minimally invasive approach. I was able to realign the toe with just a couple bone cuts, and I was able to realign the toe, again, with some soft tissue balancing as well. Ultimately, no metal was needed, no screws, pins, plates, none of that was used. We were able to get the correction we needed through the minimally invasive approach, but through the external bandaging. And so here is an example of the external bandaging, and this is something that I coach my patients on how to do. For the first few weeks, I myself as a surgeon will see the patient back and splint the patient in the correct position. But then after the third, fourth, fifth week, I coach the patient on how to do this, and so they start to do this at home. And really after the fourth or fifth week, we stop bandaging altogether and they go back to normal shoes. Just to kind of highlight the big differences between traditional hammertoe surgery versus minimally invasive surgery is incision size is just a poke hole. We don't use sutures. There's less swelling. There's definitely a way better cosmetic approach to this, and we don't use any metal, no pins, no screws, no nothing to hold the toe in place. And the results are amazing for the patients, and they're very, very happy with these results. So if you're someone that's struggling with crooked toes or hammer toes or drifting toes, feel free to reach out to me. We can talk about a treatment plan for you. And if you're in a different state or you're working with another surgeon, I encourage you to ask your surgeon about minimally invasive surgery because it's an excellent technique, and I think that most patients can benefit from it. If you like this content, please follow me on Instagram. I have a TikTok as well and Facebook link. Please follow me on all 3 platforms for more information on minimally invasive surgery. Like and subscribe. Thank you.